Rồi, xong rồi mình học được bước 1 là intro to the endothelial cell là bị thương đúng không? Thì the cause là mới vừa nói xong, smoking, diabetic, hyperhomocysteemia, với lại oxidized LDL. So it's those called directly into the tunica intima of the blood vessel, right? So when the blood vessel wall got injured, the next step, what's gonna happen? It breaks down into detail. So the first step, our immune system, the macrophage, nhớ không? The macrophage là cái con mà khi mà mình bị thương á, có con vi khuẩn nó đi vô người thì cái con này nó là một loại của white blood cell, nó sẽ chạy tới để mà nó sẽ stick vô cái con đó và nó nuốt chửng cái con đó. Thì cái macrophage này nó cũng send được là cái thành của cái blood vessel mình bị thương, cho nên con này nó sẽ từ từ đi tới, nó stick vô cái thành và nó dính ở trong cái thành đó. Ok, và khi mà cái con này nó stick vô cái thành á, nó release cái con macrophage này nè, nó vừa dính vô cái thành mà nó release free radical, gọi là ROS. So this free radical also có chức năng là gì? Damage the blood vessel wall. Ok, nó đã bị thương rồi mà cái thằng này nó còn damage cái blood vessel further nữa. Thì cái macrophage stick into it, release free radical named ROS. Ok, thì cái RLS là viết tắt cho reactive oxygen species. Ok, thì cái free radical RLS này nó lại cause the LDL oxidized LDL, gọi là oxidation LDL, and this is oxidation LDL is really bad. It will damage the blood vessel wall furthermore. So the free radical gonna damage it, the oxidized LDL also gonna damage it. And here is breakdown like why the oxidation LDL is that bad, why it's so bad. So the first thing is toxic. Đó là một chất độc. It's toxic to the cell. Okay, it will cause further inflammation. Inflammation là bị thương rồi nó bị viêm rồi nó open. Inflammation là giống như là nó bị viêm, nó open cái lưới, cái blood vessel wall. It allow more fluid leaking out, allow more thing to come into that injury. Nó đỏ lên, nó đào lên, increase the inflammation. Okay, because of inflammation, that is when things get injured, the body gonna inflame, and then the immune system working, macrophage coming, so it's increase inflammation. Oxidant cell toxics increase inflammation. It also increase the smooth muscle growth. So the smooth muscle đó là những cái tế bào khác, nó là normally nó ở trong cái nó ở trong cái tunica intima, nhưng mà khi mà có một cái vết thương thì tụi nó sẽ roll further và nó sẽ đi vô nó cũng moving đi vô cái chỗ vết thương đó, nó đi vô cái chỗ vết thương đó và nó coi như là nhiều mấy cái tế bào mình nó tích tụ ngay chỗ vết thương thì nó sẽ narrow the vessel. Vậy nó làm cho cái chỗ đó một đống thứ, nó có cái lỗ vô đây thôi mà cái này vô rồi cái kia vô thì tất nhiên nó sẽ làm block cái vessel, nó narrowing the vessel. Ok, và cái thứ ba là this LDL also enter, nó cũng đi vô cái chỗ vết thương ấy, nó đi vô cái intima, tunica intima. Okay, and what it happened when it enter in here? The macrophage already stick in there, right? The macrophage is right there. It's right there. It's like, haha, I'm here. And then the LDL is start to, so the free radical release LDL and LDL enter intima. Nó đụng vô thằng macrophage. Thì thằng macrophage này nó sẽ swallow, nó sẽ nuốt chửng cái thằng LDL. Đó là thằng macrophage nó sẽ nuốt cái thằng LDL này và nó sẽ form một cái gọi là foam cell. Thằng macrophage nuốt thằng LDL thì nó sẽ trở thành rất là mập. Nó trở thành một cái cell very very mập, thì nó gọi là foam cell, tức là nó bigger. And you see what could happen here? It's getting fat, it's getting called foam cell, and when this foam cell develop, it's increase bigger. Eventually, it's gonna become what we call fatty streak. Okay, and this fatty streak is also is also bad. It's also increase the OS, also release the free radical OS here, and also increase the inflammation in here. So everything is damage to the blood vessel wall, increase the inflammation, and also narrowing the vessel, block the thing. So it's like a cascade of events from entering to the cell all the way the cell already dysfunction. It's got intro, it's dysfunction, and then it's activate the immune system, the macrophage activation, create release of the free radical, oxidized LDL, and then eventually create the fatty streak. Okay, we have step 1, step 2, and step 3, fatty streak. Okay, thì khi mà một cái bên sai nó how plug created. So fatty streak and plug is two different things. Okay, so beside the fatty streak, we also the blood vessel also develop plug. So this already big, fatty streak already big. Two big things together, it block the vessel. Okay, so blood vessel injury, the platelet, the fibrin and platelet is blood clotting factor. It's a helpful thing. We need it to clot the blood so we not keep bleeding, but they gonna move to the intro place, and then they clot, become a plug, become really big clot. So it's a plug, and this plug gonna decrease. So just like nó bị nghẽn mạch ống vậy đó, it's decrease the flow of the blood. So the blood flow is like decrease. So what's gonna happen? The blood is move. It's help move the oxygen, right? So decrease the flow of the blood. It decrease oxygen. When your heart is have low oxygen, you will have chest pain. You will develop angina. Just like previous lecture, decrease the flow to the heart, you have angina. And what if the plug is completely big enough to block the whole vessel? You will develop heart attack or call myocardial infarction. Also, like in lecture 22, right? It will develop a blood clot and completely block it, called MI. If it's like partially blocked, it not blocked completely, but it's just partially blocked, it will develop TI, transient ischemia. Okay, transient ischemia, it shows signs and symptoms of like a heart attack, but it's really mild. It's only temporary. It's there and then the blood flow through again and then it disappear. But khi mà có cái này á thì không chữa kịp á, thì mấy ngày sau, mấy tuần tới là sẽ fully block and become MI. Okay, thì our blood vessel is everywhere in the body. So for example, if you got a blood vessel in your leg and you develop atherosclerosis and you have a plug, and the plug there is really unstable. So this is unstable plug. Unstable plug means the plug is not staying in one place. It breaks and then it travel into your blood vessel. So if the plug it break and travel to the blood vessel, if it travel, imagine if the blood clot, the blood vessel in your leg is big, so it's not blocked. But if it travel all the way to your heart, coronary artery is very small. It blocked there, you will have an MI, heart attack. If it travel to your brain, it blocks the blood vessel in your brain, you will have a stroke, right? It's a bit of weight. If it travel in your lung and block the vessel there, and you will have pulmonary embolism, right? And thrombos, it means blood clot. Embol also means a blood clot. So there's a blood clot in your lung. If it travel to it big enough to block the blood vessel in your leg, you will have leg pain, right? You have leg pain and you have like DVT, deep vein thrombosis. Okay, so it's really dangerous, but it happened over time. So you can use medication to help modify it, to help lower the risk, or to resolve the disease. So this plug here, the first thing, what's called plug is platelet and fibrinogen. So this clotting called blood. So what you can do, you can take medication to prevent blood clot. blood clotting. So what medication you can think of over the counter that you can get? Aspirin. Aspirin is to help prevent blood clots. So that's why they recommend adult over 50 take aspirin 81 milligram every single day. When you take it, it make your blood less clotting, thì nó dễ chảy máu hơn khi mà bị níp hay bị gì, khi làm móng cho người ta. Nếu mà người ta nói I take aspirin every day, you need to be extra careful because their blood gonna not clotting if you cut them. Okay, so aspirin, or you can modify your lifestyle, exercise, stop smoking. Nếu mà về đó, về đột quỵ xong bác sĩ kêu đừng có hút thuốc nữa, thì về bỏ thuốc luôn. Thì stop smoking, exercise, so you prevent diabetic. You also decreasing this LDL when you exercise. If you modify your diet, eat low fat, low cholesterol, low salt diet. So those healthy diets can help lower the substance that making this fatty streak and plaque here, right? It's involved into the lipid, the fat. Okay, so that's the one from first step 1 to step 3 into the deal, and you get a fatty streak. He is a better, okay, he is the better function, a better picture for you to look at. You look at the picture, okay? So there's a lipid around your tunica intima. When it get intra, it's have opening here. This macrophage here gonna come to the place, right? And then this a platelet. This a macrophage. The monocyte macrophage comes, sticks to the plate, sticks to the platelet here, clotting. Okay, so now it's create a fatty streak. So fatty, this is a normal, then a fatty streak right here. Okay, it start to narrowing the blood vessel. So fatty streak here, right here, this include macrophage, platelet attack. Okay, forming macrophage. This is form cell. So this is normal macrophage, and then macrophage swallow these lipids, and it's become form cell. Okay. This red thing is the smooth muscle. So smooth muscle originally it's a muscle creating the lining of the heart, but it will increase its growth, and then it's moving to here, make it become bigger. The lipid, the LDL also come in here, make it become bigger. Fibroblast are the dead cell that's like getting into, and then it just like stay there, not functioning. It also come in here, create a fatty streak, and then when the fatty streak eventually become the fibrous plaque. So I'm sorry, I say the plaque and the fatty streak is two different things, but belong. It's the same thing. The fatty streak then eventually become fibrous plaque. It's become bigger, you see. So the fibrous plaque is like, here's a collagen cap, fibroblast, lots of fibroblast, non-functional cell, nucleus cell. It just be there to like làm sơ cứng, hardening and thickening of it. It not contract, not relax, not flexible. Okay. And this is the whole lipid mở với đầy đồ. And when it càng ngày càng lớn, thì what it's gonna do? It's become a lesion, complicated lesion. So this is a blood clotting, thrombus. Okay, so it make a blood clot. So this is thrombosis, the blood clot, it breaks off and travel, or it block this blood vessel causing MI, heart attack, or it travel to other place. Okay. Tại vì cái collagen cap này is getting thinner, and there's a fissure, là những cái vết rách. Khi mà nó rách through this this collagen cap ấy, the liquid nó lại là một vết thương nữa, nó hở ra lở loét ra một vết thương nữa, thì blood nó lại clotting over here, the mixed with the lipid create the blood clots here. Okay. Yep. So communicating plug, the plug will rupture. The plug will rupture tức là nó bể và nó hở, nó lở loét cái underlying tissue causing the platelet gonna dính vô trong adhesion, đúng không? Platelet they stop the blood clotting, causing cascade, and then you create a blood clot. Okay. So take aspirin. So complicated lesion equal thrombosis, tức là một vết nứt hở ra là complicated lesion. It's causing cascade of blood clotting, create a blood clot. Okay, and this thrombosis will increase occlusion, blocking of the blood vessel, infection, mean like heart attack can occur. Okay, so atherosclerosis is là một trong những lý do chính cause đến cái bệnh coronary artery disease, or CAD, tức là cái atherosclerosis này. If it happen at the coronary blood vessel, or if the plug break and the blood clot travel to the coronary artery, is so-called a disease here. Okay. If it involves the coronary, it's called heart attack. If it involves the brain, central nervous system, it's called stroke. Okay. Okay, so then that's all about atherosclerosis. Next, we will learn about coronary artery disease.